Hello guys, welcome to my channel. In this video, we are going to discuss about the chronic tonsillitis. Before video, I'm discuss about the acute tonsillitis and adenotonsillitis case presentation. Now, let's enter into the chronic tonsillitis. The objective of the chronic tonsillitis. Chronic tonsillitis is the one of the most important repeated university question. In objective, we are going to see about the etiology, types of chronic tonsillitis, and what are the clinical features, how the patient presented with chronic tonsillitis, and how to we examine the chronic tonsillitis, and how to treat, and if we not treat the chronic tonsillitis, what are the complications present. Okay, first, etiology. Complication of acute tonsillitis and microabscess. If we doesn't properly treat the acute tonsillitis and microabscess, it leads to chronic tonsillitis and a subclinical infection. Subclinical infections means there is no symptoms, but infection is always present in there and mostly affects the children and young adults. Chronic infection in the sinus and teeth may be predisposing factor. Chronic infection in the sinus or teeth. And coming to the types. In acute tonsillitis, there is a 4 types of acute tonsillitis, but it is in chronic, it is the 3 types. First, chronic follicular tonsillitis and chronic parenchymatous tonsillitis, and the third is chronic fibroid tonsillitis. First, chronic follicular tonsillitis. Here, tonsillar crypts are full of infected cheesy material which shows on the surface as a yellowish spots. We already seen in the acute follicular tonsillitis. In acute follicular tonsillitis also there is a yellowish spots. Here tonsil crypts are full of infected cheesy material. The crypts is infected with cheesy material. So the outer surface of the tonsil looks like there is an yellow spots over there. And next is chronic parenchymatous tonsillitis. There is a hyperplasia of lymphoid tissue. Hyperplasia means increased number of the cells. Tonsils are very much enlarged and may interfere with the speech, deglutition, and respiration. That means here chronic parenchymatous is hyperplasia of the lymphoid tissue. So there is an enlargement of the tonsil. So the enlargement of the tonsil leads to we can't properly speak, and we can't properly swallowing any food materials, and it interfere with the respiration also. Attacks of sleep apnea may occur because it obstructs the air pathway. Long standing cases develop feature of cor pulmonale. And coming here, you can clearly see the enlargement of the tonsils. So it obstructs the respiratory pathway and speech and deglutition. Coming to chronic fibroid tonsillitis. Tonsils are very small but infected with a history of repeated sore throat. Here tonsils are very small but infected and sore throat is present. Clinical features. How the patient presented with chronic tonsillitis. Recurrent attacks of sore throat. Sore throat is the most common complaint of the patient. Chronic irritation in the throat with cough and bad taste in mouth and foul breath. Halitosis is present. Halitosis is foul breath due to pus in the crypts. And thick speech, difficulty in swallowing, choking spells at night. And examination. Tonsils may show varying degree of the enlargement. Meat in the midlines means it is the chronic parenchymatous tonsillitis. We already seen parenchymatous means hyperplasia of the lymphoid tissue, enlargement of the tonsil. So, if the two tonsils are meet in the midline, that is the chronic parenchymatous tonsillitis. There may be yellowish beads of the pus on the medial surface of the tonsil means that is a chronic follicular type. And tonsil is small but infected, but pressure on the anterior pillar express the frank pus means it's a chronic fibroid type. Okay. And flushing of anterior pillars compared to the rest of the tonsil pharyngeal mucosa is an important sign of chronic tonsillar infection. In the chronic tonsillar infection, um, flushing of anterior pillar is seen, and enlargement of the jugular-digastric lymph node is reliable sign of chronic tonsillitis. In chronic tonsillitis also, there is an enlargement of jugular-digastric node. During acute attacks, the nodes enlarge further and become tender. In acute, there is a tenderness is present, but in it is chronic with just enlargement of the jugular-digastric node. And coming to treatment, how to treat the chronic tonsillitis? First, conservative treatment. First, we give attention to general health, diet, and treatment of coexistent infection, teeth, nose, and sinus. Maybe chronic tonsillitis associated with the sinus and caries, tooth caries. So we have to first treat this coexistent infection, and also we have to um, maintain the diet. And coming to tonsillectomy, when tonsillectomy is indicated, when it is interfere with the speech, deglutition, and respiration. And coming to complications, if we doesn't treat the chronic tonsillitis, what will happen? It further the infection spread to near areas. So it leads to peritonsillar abscess, parapharyngeal abscess, intratonsillar abscess, tonsilloliths, and tonsillar cyst formation. And focus of infection in rheumatic fever. If it is caused by the beta hemolytic streptococcal infection, leads to rheumatic fever, acute glomerulonephritis, and eye and skin other disorders. And coming to the one of the complication is tonsilloliths. Tonsilloliths means calculus of the tonsil. Calculus means stone. It is seen in chronic tonsillitis when its crypt is blocked with retention of the debris. In first, the pus or debris is accumulate in the crypts. So, and also accumulation of the or deposition of the inorganic salts like calcium, magnesium leads to stone formation. It may be gradually enlarge and then ulcerate through the tonsil. Tonsillitis is mostly seen in adults, and the patient has local discomfort or foreign body sensation. Easily we are diagnosed by the palpation or gritty feeling on probing. And treatment is very simple: removal of the stone or tonsillectomy. If the if that be indicated for associated sepsis or for the deeply set stone which can be removed. And coming to intratonsillar abscess, it is the accumulation of the pus within the substance of the tonsil. It is usually follows blocking of the crypt's opening in acute follicular tonsillitis. The patient has local pain and dysphagia, and tonsil appears swollen and red. Treatment is antibiotic and drainage of the abscess if required. Later, tonsillectomy should be performed. And coming to tonsillar cyst, it is due to blockage of the tonsillar crypt and appears as a yellowish swelling over the tonsil. Very often it is symptomless, it can be easily drained. Tonsillar cyst is blockage of the tonsillar crypts and appears the yellowish swelling over the tonsil. See, you can clearly see here yellowish cyst. That is tonsillar cyst. And thank you.